540 new cases have been reported in India in the last 24 hours. And the government now has sanctioned 15,000 crore rupees as a COVID relief package. This is a big story that is just coming in. Remember, there are 5,734 people affected by the coronavirus in India. The death toll has gone up to 166 people. The government taking cognizance of the current situation on the ground has announced 15,000 crore rupees as an emergency COVID fund. Sunil joining us on the broadcast with the details. Sunil, what more can you tell us?
Well, two important points. One is that 15,000 crores has been allotted for this. This is going to be a centrally funded scheme, as we have been giving this story from this morning when it was announced. Having said that, the most important aspect is that 4,500 crores has already been given to states. Now, the big question that everybody would want to know is what will it be used for? It's going to be used in terms of COVID hospitals, it's in terms of PPP equipments, N95s, any other requirements in terms of strengthening laboratories and various other outreach and community programs. So it's basically a huge fund which will be given to the states so that they can optimally use this fund. 15,000 crores is the allocation now. It's a 5-year program. We do not know whether this is for 5 years or this will be further augmented, but definitely states are going to get a lot of money, and this is going to be 100% relief funded, because this is as the Prime Minister said yesterday, this is like a national emergency. Having said that, the centre is also deputing 10 central teams to 9 badly affected states. There have already been joint secretaries who have been deputed to various states. They will now assess the situation there and give a further feedback on what should be done and what can be done in the next few days. So it's in this backdrop that a full assessment will be made. The Prime Minister, as you are well aware, will be speaking with Chief Ministers tomorrow to assess the situation and take a final call on the lockdown. Of course, as we already been reporting, Orissa has already extended it by another 15 days till April 30th. So it's in that backdrop we will have to wait and watch and see how things evolve.
All right, an emergency response and health system preparedness package there being announced by the Government of India. The money is going to be released to states for implementation, like Sunil is saying, in a phased manner. Sunil, very brief follow-up question. Do we have any idea of how long this money is going to be staggered for, what the allocation is going to be like? Certain states perhaps, which are reporting more number of cases, more containment zones, more hotspots area, will they be allocated more funding? Any clarity on some of those specifics?
Definitely, there will be, for those states most badly affected, where there will be an urgent requirement. I think funds will be given immediately for them. It's a 3-phase program. One is which has already started from January 2020 to June 2020. Then it's the second phase, which is June 20 to July 2020 to March 2021. And then, of course, the final phase, which will be April 2021 to March 2024. So it's a clear-pronged strategy, 3-phase. They would like money to be given. Of course, as everybody will expect, 15,000 crores is not going to be adequate for states. There are certain hotspot areas, there are certain states, because if you look at the graph as well as the geography of the entire area, there are only 13 badly affected states as of now. So they will definitely get a larger chunk. There will be a certain focus on them at this stage, and definitely, but everybody needs to be prepared and everybody needs to take prevention and adequate safeguards for this.